Let's start with the first space, that is the parapharyngeal space. These are paired, central, crescent-shaped, fat-filled space in lateral suprahyoid neck. It just contains the fat and thus it is visible on CT as well as MRI. As it contains only fat, therefore rarely any lesion is seen arising from it. The parapharyngeal space extends from the skull base to the inferior cornu of hyoid. Inferiorly it is open and it communicates with the submandibular space as seen in this diagram. As rarely lesion arises from the parapharyngeal space, disease if seen in the parapharyngeal space usually arises from the adjacent space. Identifying the direction of the displacement of the parapharyngeal space by the mass helps in determining the space of origin. For example, if the lesion is arising from the pharyngeal mucosal space, it will push this parapharyngeal space laterally. Similarly, if it arises from the masticator space, it will push it posteriorly. If it arises from the parotid space, it will push it medially. If it arises from the carotid space, it will push it anteriorly. If it arises from the retropharyngeal space, it will push it anterolaterally. The fascia surrounding the parapharyngeal space is made up of all the three layers of the deep cervical fascia. Anteriorly, it is made from the superficial cervical fascia, superficial layer, and medially it is made from the middle layer of the deep cervical fascia, and posteriorly it is formed by the deep layer of the deep cervical fascia. Very rarely any primary lesion arises from the parapharyngeal space. The most common being the benign mixed tumor or pleomorphic adenoma of the parapharyngeal space. When the lesion is surrounded on all sides, that is well circumscribed with the fat on all the sides, that means it is the primary lesion of the parapharyngeal space. If it is solid, it is mainly benign mixed tumor. If it is cystic, then it can be second brachial cleft cyst. So you should just remember these two names, the pleomorphic adenoma of the parapharyngeal space or the second brachial cleft cyst. As seen in this actual CECT, a well-defined, slightly lobulated mass within the left parapharyngeal space. The mass is completely surrounded by fat, separating it from the pharyngeal mucosal space medially, parotid space laterally, and carotid space posteriorly. Thus, it will be benign mixed tumor of parapharyngeal space. This is it about the parapharyngeal space. Thank you.